Hi, my name is Nidhi Sharma. I'm a women's health physical therapist and a pelvic floor specialist. Today we're going to talk about pelvic floor dysfunction and interstitial cystitis or bladder pain syndrome. Bladder and pelvic floor are so closely connected that the symptoms created by pelvic floor can almost completely mimic the bladder pain symptoms. And today I'm going to explain to you why. So let's first talk about bladder pain syndrome in itself or interstitial cystitis. Those are interchangeable terms. So for IC diagnosis, it is a clinical diagnosis, which basically means that there is no imaging or blood test that confirms the diagnosis. It's entirely based on symptoms. Most people have two symptoms. First is bladder pain, which is pain, discomfort, pressure, feeling in the lower abdomen or pelvic region, especially when the bladder fills. This discomfort is often relieved temporarily when you empty your bladder, and then it comes back as the bladder continues to fill. Number two, urinary urgency and frequency, which basically means that you have this urge to pee again and again. Most people are peeing 8 to 10 times a day or more and peeing at night. And then urgency, which means you have this sudden urge to pee out of nowhere. So bladder pain or pelvic pain, urgency and frequency. Those are generally the symptoms that most people are feeling when they get the diagnosis of interstitial cystitis. Okay, now hang with me as I explain to you where pelvic floor is and how it can create all of those symptoms without involving bladder sometimes. Okay, so this is your pelvis. This is the bone on the right. This is the bone on the left. This is the bone in the front. And this is the bone in the back. Your spine would be here. When we look inside, right behind this bone is your bladder. Okay, bladder where the pee collects. Right behind the bladder is uterus, and behind the uterus is rectum. In men, there is no uterus, and the prostate sits right under the bladder. When we take these organs out, everything that's red inside is your pelvic floor. So big muscles of pelvic floor sit inside the pelvis and form a hammock from front of your pelvis to back of your pelvis, and your pelvic organs literally sit inside this cavity. There are also small muscles of pelvic floor that sit at the opening. Okay, so your urethra where you pee from, vagina and anal opening, these small muscles of pelvic floor wrap around these openings and help you stop your pee and start the urinary stream. So now you can see how these muscles that sit so close to the bladder, if this muscle was to cramp or spasm or be sensitive or unhappy due to some reason, this muscle can literally create compression or pressure on the bladder. It can restrict the filling of the bladder by mechanically compressing on it. And this compression or irritation of the bladder lining can very much feel like the discomfort with filling that most people recognize with interstitial cystitis. Also, the small muscles of the pelvic floor, these ones, will actually wrap around like collar around the tube from which the pee comes out. So as the bladder fills, this is the tube from which the pee flows out. And as it flows out, these small pelvic floor muscles form collars around right here, form collars around this tube. When these small muscles get tight, they can squeeze this tube from which the pee comes out and cause urgency and frequency. So you can see how deeper muscles can cause that pressure, pain feeling. Superficial muscles can cause urgency, frequency feeling. So with tight, deep and superficial pelvic floor, you can have all symptoms that say interstitial cystitis or bladder pain syndrome. Research suggests that more than 80% of people who have IC also have some degree of pelvic floor dysfunction. Pelvic floor dysfunction may have developed as a result of IC, it may have developed before IC, or it may have developed as the IC was developing. In pelvic floor physical therapy, we teach you how to relax these muscles. We manually stretch these muscles. We also teach you how to relax these muscles. That may involve manual therapy. It may involve postural correction, breath correction, nervous system improvement, diet, abdominal mobility, motility, and a lot of other things. Decreasing the resting state, improving the resting state of these muscles can really improve how much your bladder can fill and how easily can it empty. Most people who have pelvic floor therapy improve even if they have ulcers in the bladder, and even if they have severe IC symptoms, they will generally improve with pelvic floor physical therapy. So if you have these symptoms, consider pelvic floor PT. If you have any questions, drop them here and I'll try to answer them, and follow along for more IC tips.